Hey guys, this is the Beyond the Surface podcast with Diogo Trevisan. My guest today is a personal friend and someone that I admire. This guy is a beast of an orthopedic surgeon, and I had the pleasure to work with him for several years now. We want to not just scratch the surface, we want to know what happens behind the scenes. And I say that often, people don't know how much work goes behind the scenes when a professional does what they do really well. And Riley is an example of someone that goes beyond for his patients. And I had the pleasure to rehab some of his surgical reconstructions, and it's really amazing. So, to start the conversation, Dr. Riley, thank you for being here today. We have a setting and we didn't make it today, but we're going to do it next time. So for today, let's start with an introduction. Tell the listener about yourself and what is it that you do.
Thank you, first of all, for having me on. I mean, this is really an interesting experience for me. My first time ever doing podcasts of this style, so it's pretty fun to get to do something like this, especially with you. We've had, like you mentioned, a great start to, at least for me, a great start to my career was connecting with you, getting to know somebody that I trust and can work with from the physical therapy side of things once I got started. So, yes, my name is Dr. Thomas Riley. I'm an orthopedic surgeon. I work here in the Miami area. So I'm an ex focuses on extremities and sports medicine and total joint replacements. I also do work on fractures, fracture care and surgical procedures of that nature. And I do quite a bit of procedures. The only thing I don't really operate on is the spine, but other than that, pretty much anything else is within my experience and background and training. I work at Legacy Orthopedics. It's my own practice that I started here about 5 years ago in Miami. I'm the sole physician. I do have a physician assistant that works with me, and I have 5 staff members now that are full time with me as well. It's really been it's quite a great experience so far to get started on my own practice this early in my career.
Awesome. Awesome. I also bring this up often, you're a business owner. So there's the clinical aspect of helping people out in surgery, and there's so much medicine behind it, like complications, emergencies, and whatnot. And people like picture that side of medicine. Now tell us what's like to run a practice and you're the physician at the same time.
Well, it's like having two full-time jobs at the same time. I mean, certainly it's no small feat. It takes a lot. And I can tell you that kind of serendipitously, I decided I always wanted to have my own practice and start my own practice. Wasn't always sure how to do that and if it was even possible in this day and age when I was training in residency and fellowship. But as we got through COVID and there was a lot of downtime from a medical standpoint. A lot of surgical centers were not doing procedures. Hospitals were doing the bare minimum just for patient safety reasons, of course. There was a lot of time, at least for me, to kind of sit around and think about what's my next move and how I'm going to move forward in my career. It really, I think, pushed me in the direction of getting into it and opening my own practice just because of that instance and that kind of crazy time we all went through with COVID. So it was quite interesting. Not something I expected. I certainly didn't expect to start my own practice this early in my career. And the reason was you're right, it takes quite a bit to get through your medical training. Um, and it's very daunting, especially when you start as a new physician. When you first come into practice, there is a lot to know. You have certainly gained a lot of experience through your training, but you certainly don't experience everything. You don't see and do everything that you eventually will do in your practice. You still have quite a bit of experience to go through to really say you've seen it all. And truthfully, you may never get there in a lifetime. There's just so many different things that can come about through medicine, and it is quite a broad field of different things that you'll see, different things you'll do. So there's a lot to it. Owning the practice is a whole nother education in and of itself. Certainly we don't get any training in this when it comes to running any type of business. And a lot of what it has to do with running a practice, even a clinic or let's say surgical center, anything of that nature, there is zero education on that when you go through your medical school, residency, fellowship. I mean, certainly, as you would expect, it's really just focused on the medicine and patient interactions and surgical techniques. So, all of those things you have to learn on your own in your spare time and try to navigate through it that way. And so it's quite a bit. But like I said, COVID was a help in that sense because I had some of the downtime to focus on that. So I think it accelerated something that would have taken a little bit longer to get there, but nonetheless, it is achievable. It just takes quite a bit of time.
Correct. Yeah, when we linked up, the world was still like pretty much shut down and we were like under, the whole what's you call the distance like you have to
You're
keep a
right.
certain distance. What is it called again?
6 feet. You got to keep that
Yeah.
6 feet.
Wearing masks and washing hands every 10 minutes. And to the listener, we dropped by each other's office once in a while, and we're on the same boat, kind of like growing slowly and getting busy. And I remember recently coming up to your office and we're busy, right? But then patients are coming back and I've never heard a single complaint. And I want you also to expand to the listener because they're thinking Dr. Riley is on top of vascular issues, skeletal issues, myofascial issues, neuromuscular diseases, autoimmune, and whatnot. Like there's so much that can come to play with chronic pain and, surgeries, and you have to have your eyes on everything, like systemic conditions. And you're also running a practice with how many employees you have in total?
5 employees.
5 employees. And I have this impression when I walk into places because I'm very type A with like cleansing, and I walk in places and I notice like your office is immaculately clean and is super organized and it looks modern. So tell us about that. Tell us a little bit about your own leadership inside of the office, but for the person to understand how much works goes behind the scenes about hiring and answering promptly and the paperwork that whole go behind the scenes and even the learning curve if you want to share, like how it was in the beginning and then hiring and
Yeah.
expanding.
Well, I think it's something that, as a business owner, you sort of fall into it naturally in terms of who you hire, who you connect with, who you think will be a good fit for your business. It has a lot to do with your personality. I mean, certainly, I'm one of those people, and people might be surprised. Not all surgeons are like this, but I'm very focused on organization, making sure I have my lists, my color coordination. I'm very systematic in that sense. And trust me, I've seen phenomenal surgeons who are not that organized. You could go to their office and there are just books and papers all over the place, and it looks like a mess. Doesn't mean they're not good at what they do. It just means that that's just their style of how they sort of manage their surroundings. And you'll find that you'll meet the right people, and you'll sort of inherently end up connecting with and hiring people who are kind of like that you see maybe something in yourself in them, and vice versa. And I think those are the good connections that you'll make, and those are the employees that will stay with you. And then that will reflect on how you essentially your office is presented. Of course, I don't have the time to be there every day cleaning the office, but my staff does. And um, the truth is they clean when they can because they are naturally just want to see things organized and orderly and neat.
Yeah.
Again, doesn't mean it's a bad office if you see something a little cluttered, things like that. It just means that's the personality of the people that are there. And it always comes top down. I mean, I used to hear that when you would, look at or discuss, big Fortune 500 companies, things like that. You'd always hear it comes from the leadership, everything comes top down. I mean, it really is true. 100%. How you are as a leader, even if you don't try to force a personality, a leadership type of personality, just on your own basic, normal, inherent behavior. That does show through in everything else around you when you're in that role as a business owner. For sure, that's true.
Yeah, 100%. I
Yeah.
we treat my without violating HIPAA, my baby's pediatrician, and he approached us like three times in three different instances. It's like, man, how do you keep your bathroom so clean? And it's what you're saying, like it turns out the team is an extension of us and they care just as much, like you walk in a pristine bathroom, you're like, you feel so comfortable, like it smells good, so but you're saying like it's an extension of the culture that you created and you end up like attracting the same type of people. So that's really cool, man. What I want to know also, and I don't think people realize how much work it goes on the clinical side. Tell us a little bit about med school, how long you study and how long is the specialization to become an orthopedic surgeon, and tell us a little bit of this process.
Well, certainly there's as you would imagine, there's a lot of education that goes into getting you to become a physician. You, of course, have to go through undergraduate school. In my instance, I even went to a graduate program for 2 years, and that was really focused on more research-based medicine. Because initially I was interested in that. I thought I would incorporate that as a large portion of my practice one day. So I really wanted to get some more in-depth background on benchtop research, let's say. So I did 2 years of a graduate program after my undergraduate schooling. So then I went on to medical school after that, which is a 4 year program. The first 2 years, you're mostly in the classroom and learning didactically. You go to lectures, you read your textbooks, you have your tests. It's kind of like an accelerated form of undergraduate or graduate program at that point. But the third and fourth years of your medical school are more clinically oriented. You're in the hospital or the surgery center or the clinic with the physicians, with the staff, and kind of sort of integrating yourself in with the system from that standpoint, more practically and more hands-on. You still have still some classwork and you still have a lot of reading and test taking, but it's a lot more light, practical in terms of what you're going to be doing when you finish. Once you're done with your medical school training, so you finish that 4 year program, you go on to a residency. Now that can be in different lengths of time depending on the specialty you go into. Most surgical specialties, as in my case, are 5 years. So I did a 5 year orthopedic surgery residency program. And at that stage, you are focused solely on the specialty that you're training for. So I spent 5 years doing only orthopedic surgery. You do have some other coursework, for example, in the very beginning with some general surgery rotations and radiology rotations. But for the most part, I'd say 90%, if not more, of your training is just orthopedic surgery. You cover all the specialties from, spine to pediatrics to general orthopedics, sports medicine, trauma orthopedics. You kind of cover it all. You work in the clinic, you work in the surgery centers, you work in the hospital, you work in the ER, and you basically do as much as you can do. And that's a 5 year training program. That's standard for any orthopedic surgeon.
Mhm.
In my case, which is true in most cases nowadays, I did a fellowship after that, which was a 1 year fellowship program in orthopedic sports medicine.
Mhm.
That's what brought me to Miami because my program was at Doctors Hospital, now Baptist Hospital, and I was able to do a sports medicine program. There, we're focusing a lot on arthroscopy or minimally invasive surgery, as well as sports medicine care and treatment. So a lot of our patients were athletes of all different levels, but of course, even up through the professional levels. The group I worked with covered the Miami Dolphins, the Miami Heat, the Miami Panthers, and I had the opportunity to work with all the teams while I was there as well under their direction. So that was a phenomenal experience, something that extremely accelerated my understanding of sports medicine related cases. But one of the things that is important to keep in mind, most orthopedic surgeons, most specialists or surgeons in general will kind of focus on a specialty, whether they focus on just joint replacements, just sports medicine. Yeah, some will go into oncology. Some will become generalists, but typically, if you do a fellowship, you tend to come out and want to practice, focus mostly on that fellowship. In my case, I always knew I wanted to do a little bit more broad variety of procedures. And I think that's one thing that maybe sets me aside from most surgeons in the area, or just in general, is that even though I have a sports medicine fellowship, I didn't just stop and do only sports medicine after that. I continued to do joint replacements all the way through my fellowship. I continued to do the ER coverage and fracture care, things of that nature. One thing I noticed early in residency is that a lot of patients found an orthopedic surgeon that they really liked and trusted. So the guys that would train me, I would see their patients really connect with them and really, trust them and like to work with them. And what would happen is they would say, yes, thank you for treating my shoulder, but I also have this knee issue too. Can you take a look? And then they would basically say, oh, well, my partner or somebody else down the road does that. I don't treat that. And you could see the patients, they understand, but it's not ideal because medicine is not just medical treatment. It's a human connection too. And that's a very important part of the whole process that I think maybe patients have a better understanding of than physicians do at some points, because I think that I found that I always wanted to be able to treat my patients for a wider variety of what they needed, instead of telling them I only can treat your shoulder, everything else you have to go find another doctor, another surgeon, and figure it out from there. So that's why I kept up a lot of my skill set to include a broad variety of surgical treatments and evaluations.
I love that you brought that up for those two reasons. One, so you have access, like you have so much more to offer to like this one patient may be dealing with, a whole bunch of issues and they create this connection and, you know, um, and the building the trust part, the patients, the feedbacks that I get from the patients that go to you is they walk out. I have people call me from their car to say, "Man, thank you so much for connecting me with this guy. It's like, he sat down with me and he explained and like and we connected." So uh, first of all, I agree 100%, right? Physical therapy, so much also of like, touching and building the connection. They're there 3 times a week for the most part. So they cry on us. We get to know them. And, some of these people came to my wedding and they're still treating with me, like 14 years later, so you really build this connection. Um, I have someone that I consider like one of my best friends. He's a true friend of mine, and he used to be a patient like 15 years ago. So but also, there's a book by Dr. Lisa Rankin, Mind Over Medicine. She's a physician, and she, talks so much about the importance of this physician-patient relationship. So the attention that comes behind the treatment. And we know, statistically that experience trumps results. You can be an amazing surgeon, but if the person that have doesn't have an amazing experience at the office, they may walk out and say, you know? So
Mhm.
there are some geniuses and like so skillful with their hands and amazing surgeons, but everyone walk out and saying, "Oh my God, this guy's so rough around the edges and communication was terrible." And the thing that we hear, like, "Oh, he spent 30 seconds with me."
Mhm.
So we can justify, so we can go both ends of the spectrum, and I want to hear from you, right? Um, we there is a problem in healthcare nowadays. There's a reason why surgeons are spending 30 seconds with a patient. That's an exaggeration. We never know if that's true, if that's timed up. There is an issue with healthcare, but what I say that the patient will never understand is this guy's trying to save the world. Like they think all he cares about is the money, reimbursement. He doesn't care about patients. And the physician may be thinking, I'm trying to help as many people as I can, given the circumstances, and he's doing his best, she's doing her best, right? So give us a little sauce in that, like you're
Sure.
in the field, like what do you think?
You're 100% right. And there's certainly, I think that's something that's hard to appreciate from a patient standpoint, and rightly so. I mean, you're not behind the scenes. You don't see what goes on behind a practice in terms of getting a patient scheduled, getting him into the office, and then making sure that you have the insurance coverage because it's important on both ends. You don't want the patient to have to pay more money than they should because there's some insurance coverage issue or some issue with reimbursement, because that can happen too. It's not just that they won't pay the physicians or won't pay the physician the way they're supposed to, let's say, but they'll push the costs onto the patients in some cases. And you try to avoid that at all costs, in any way you can, because you pay enough in insurance as a patient monthly anyway. So you want to pay only what's due and nothing more. But from a physician standpoint, I mean, you're absolutely right. I mean, it's not something that is the first thought we have when we schedule a patient or when we talk to a patient or when we're preparing to see a patient. It's absolutely an afterthought, which, from a business standpoint is backwards, but it's just the nature of medicine. I mean, you're a physician first, and then you deal with the business second. Is at least that's how I have approached it or how I see it. Because at the end of the day, if something happens and the insurance doesn't reimburse for a visit, for a procedure, for whatever it is, as long as the patient got the care they deserved, I mean, that's the major point. That's what matters more to me than anything else. However, on the other hand, you can't keep going through iteration after iteration, losing money and not getting paid, because then you won't be able to pay your staff. You won't be able to keep the lights on. You won't be able to provide patients with a service that you want to provide them. And so there is a balancing act there for sure. One thing that is very difficult to manage, at least I learned very quickly, is it takes a lot for a physician's office to get reimbursed from insurance companies. It's not just, you see a patient, you write a note, you send it to insurance and they pay you. I mean, that's not how that works. It's how it theoretically should work. I mean, you deal with the same issues. I think
Yeah.
everybody, any physician, even hospitals, everybody deals with the same issue. There are so many regulations. There are so many guidelines you have to follow. And these guidelines and regulations change frequently, and you have to be on top of them. So that means, you have to outsource some of it, and some of it you have to train your staff to understand and know. So, from a business standpoint, every dollar that you make costs you a lot of pennies to make that dollar come through the door. It's not just 100% profit. You're making very small margins when it comes to what you're getting reimbursed.
Yeah.
And it takes probably 3 times the work behind the scenes than it does actually seeing a patient when it comes to doing proper billing and everything, so that you and your patient don't have any issues from that end. So every patient that gets scheduled with us, I have to have a staff look through their insurance plan, make sure that we cover that plan. Not every insurance company, they don't have just one plan, they have multiple plans. And if you have a specific insurance plan, that doesn't always mean, even though I cover that company's insurance plans, I might not take that one specific plan. And that's not because I don't want to. It's because the insurances won't credential me with that one specific plan. They just won't give me the opportunity. And even though I apply over and over again, they just deny it. They or just don't look at it. They never respond. So I could tell you this happens once in a while with Blue Cross, Florida Blue, United. They have very specific plans that even though I take almost all of their other plans, there are some that they just never credential me with and don't give me the option to take it, which is strange because a patient will say, "You take United?" I say, "Yes, I do." And then they say, "Well, I have this plan." I'm like, "Well, I don't take that United plan." But it's
Yeah.
not because I don't want to, it's because they won't let me.
Yeah.
So, which is really strange. It doesn't really make a lot of sense. And I honestly don't really know the answer as to why that happens, but it's very common. So there's a lot of work we have to go through because if we see that patient anyway, and we think that just because it's, let's say, that United plan or whatever, we think that everybody's going to get covered and nobody's going to have to pay extra money. Well, that might not happen. And they might push the bill onto the patient or onto us or whatever the case may be. So we have to have staff that knows and understands all the ins and outs of how this works. You have to have a billing company that understands how to manage these issues when they come up. I mean, I can tell you insurance companies can make mistakes on their end and then just stop paying you completely for weeks and months at a time because they decided to change your, identification number in their system. Has nothing to do with you or anything you did. They made a mistake and the only reason you find out is because they just stopped paying you for everything. And it can take weeks and months to correct it. Patients don't understand that those things happen routinely.
Yeah.
And it's the clinics and the offices, like we do everything we can to avoid these issues, but a lot of it's out of our control. So that's why it's very important for us to have, the staff that's trained well and all the systems in place. So, and on the other hand, too, it means a lot to us when you do show up for your visit and everything goes smooth. You remember to bring your insurance and your ID. I mean, that's super helpful for us because if we don't have this information, it's very, very challenging. And also, this day and age, it's kind of difficult and more, challenging for patients that just, if there's a no-show, if the patient just can't make it that day or something happens or comes up. I mean, people's lives are busier now than they've ever been, it seems. So it's totally understandable. But if you have no patients that just don't show up for that visit that day, that's a lot of work that your staff did on the back end that was just wasted. So but what can you do about it? It's not like other businesses that can charge you or bill you for not showing up. Like we don't do that. Some places do, but we don't do that. But as long as people understand, it means it takes a lot to even get people on the schedule,
Yeah.
and a lot of it's because there are challenges with billing from the insurance standpoint.
Yeah, man, this is such a common problem, and we could rant about it because obviously we deal with the exact same issues, and you were able to summarize this perfectly. I love this. Like everything you said, I'm like, okay, the listener now is going to understand the amount of work that goes behind the scenes. We're wrapping up. This is supposed to be a short episode, and what I want to leave here to the listener is next time we'll talk about clinical stuff. So the conversation is, does this heal or does this injury doesn't heal well and we need surgery? Is it 50-50? What are the complications? What are we looking at post-op? Do I need meds? Am I gonna be in pain? What does rehab look like? And we can, in our own fields, like have this clinical talk. I think is gonna, bring some clarity on that. Um, but I love what we did today. I think I personally love the amount of work that I love watching the amount of work that you put in as a physician. I admire how much when we talk, I know that just the words that you're using and the way you're explaining diagnosis and everything that is being done, the patient's going through, like how much knowledge you have on the medical side. And I wanted the listener to know as well how much effort and how much energy you put on running a business well. And it's not by mistake that you have awesome reviews and people leave saying, wow, but I want the listener to know that it's not just being a great physician and being a good clinician. There's so much work behind the scenes. Our next conversation will be strictly about clinicals, chronic pain, trauma. We're going to specifically talk about surgical versus conservative treatment so we can, shed some clarity on some of those common questions that patients have. But for now, I wanted to thank you for coming over and I appreciate the time. And next time we'll be doing that in person on SAT. So this is going to be exciting. But thank you so much, brother, for coming on today.
Diogo, thank you. Absolutely. It's my pleasure to come on. And I could tell you, and for all your listeners too, I mean, since I've been in the Miami area, since I've been out in practice, there are very few people that I have, gotten to meet that I feel are extremely, extremely involved and interested in what you do in medicine. I mean, that might sound crazy. People train so hard and they go through so much. So much training, so much education to get where they are in any medical field. But usually, what you see is that people get to that field and they sort of find their niche and they stick with it. But what I've learned from you, and I think one of the reasons why we've connected, is that we sort of have both been interested in expanding, what our interests are within the field that we do. And I've seen a lot of that throughout your practice, throughout your journey, starting your business and growing it, and not just stopping when you get comfortable and get good at something, but seeing how else can I, serve my patients, serve the community. What else can I learn? What other skills can I apply? That's what's really exciting because medicine is such a vast and broad, type of thing to learn, to master, to research, to study. So I mean that's it's really nice to see people who have such a strong interest and in continuing to grow, to continue to educate themselves, because your patients will only benefit from that. Everything that you do, every time you stop and read something new, learn something new, you'll apply that, and everybody around you will benefit. So yeah, I appreciate seeing you continuing your education, and it's an amazing thing to see because it's not as it's I would say it's not as common as you would think in medicine after people graduate from their program. So always a pleasure talking with you, always a pleasure, and I'm looking forward to it for the next time. Absolutely.
Appreciate it, brother. We'll wrap up now. Take care.
All right,
Catch you.
man. Take care. Talk to you.
Bye.